Hello, BT Afya family, and thank you for tuning in. For those who might be new here, my name is Agnes Betty Ntusa. I know it's been a while, so for sure we might have new followers. But yeah, so basically, BT Afya is all about raising awareness and, of course, health education on factors or rather issues affecting our women in Kenya, Africa, and the world at large, really. So this video is gonna be highlighting Mother's Day and also something to do with women's health. Of course, since May is also Women's Health Month. So thank you for tuning in and also for sticking here. I know it's been a while, but I missed you guys, and I'm gonna be here giving you all the content and all the good stuff. Love you. So bila kupoteza wakati ama muda, I know you know that today is Mother's Day. So basically, I just wanted to pass on the message to other mothers out there. You're doing a great job. New mothers, mothers who have been, of course, here for a while and seen it all. Yeah, we really love you guys and we appreciate you. And also, I'd like to also appreciate a special group that sometimes you forget about is the mothers in waiting, people who are actually trusting God for a kid. We just want to say that we trust with you and we hope that God with of course that God is going to provide for you your best gift that you could ever get, of course, of having a baby. So the other thing I wanted to highlight, the last group, and I really resonate with this group. If you've been here for some time, you know for sure why I say this. So I resonate also with people who might be grieving the loss of mothers. So I just want to say that I know it's hard celebrating this Mother's Day and maybe every other Mother's Day, but I want to say that I am with you. I want to give a hug to you. I wish I could give you a hug. So receive it on the screen. And I love you guys. Thank you so much for tuning in. So basically, this month is all about women's health, as I mentioned earlier in May. And of course, there are other issues I'm going to talk about. But really, one of the things that I really wanted to highlight, that Women's Health Month, which is in May, has been set apart to basically remind women on taking care of their health. And this might involve preventive care that involves scheduling those checkups that you've been actually saying you're going to do, but you've not done. And also getting health education to be able to understand what are some of the risks, what are some of the signs and symptoms, which I'm going to actually be highlighting in this video, just to get understanding of what is some of the checkups that you should do. And then I'll also basically just help you to understand, what are some of the series in terms of the health education. What are some of the things that you're going to be talking about in this month of Women's Health Month? I believe one of the major health checkup that every woman should actually go for is cervical health checkup. 9 women die every day in Kenya from cervical cancer. And worldwide, it's even worse. Every 2 minutes, according to WHO, a woman dies from cervical cancer worldwide. So I believe, and this is something that can actually be prevented. I think I'm also going to highlight it actually throughout the video on some of the ways that you can actually prevent yourself from getting cervical cancer. So basically, I believe that's one of the checkups, and some of the other checkups maybe I'll just highlight in brief, and then they dive deeper into cervical health. So some of the other checkups is breast health, of course your mental health, and that's of course something maybe I'll major on in another video. Sexual reproductive health, things to do with your diet and physical activity, and also your spiritual health. So diving now deeper into cervical health and why it is important. First of all, what is cervical cancer and why should you go for a cervical cervical health checkup? So we name cancers according to where they originate from. So if it's cervical, or if it's breast, it's originating from the breast, it's gonna be called breast cancer. If it's originating from the prostate is going to be called prostate cancer. If it's originating from the cervix, cervical cancer. So basically, what we know for sure, cervical cancer is linked to human papilloma virus, which is like the main linkage in terms of the cause of the disease. So to be able to prevent the disease, we need to go for the checkups that involve now the HPV, the screening. And one of the screening methods, of course, is HPV testing, which basically checks for the HPV virus. There is also VIA, which is visual inspection with acetic acid, and there's the last one, which is pap smear. So all these methods, they're going to check whether, first of all, there's a virus, HPV testing, and then if they find, of course, the virus is there, then they're going to do another triad method to check if there's any changes in the cervix, and then provide for you the next care that is needed. So basically, before I even go further to some of the other management ways, I think it's also good to talk about prevention. And prevention is, of course, through HPV vaccination. The HPV vaccination is actually available in Kenya, free of charge. I'm sure Kenyans will love free things, free of charge to 10 to 14-year-old girls, which means every girl that is aged 10 to 14 years, they're supposed to get the HPV vaccine. So basically, the vaccine is supposed to protect the child. And the reason why they are giving this 10 to 14-year-old girls is because that is when it's most effective. And of course, they have also not been exposed to the virus. So something else I also need to mention is that the HPV virus is has so many strains. Like there are so many types of them, but having also HPV doesn't mean that you're going to get cervical cancer. Most of these HPV viruses actually clear themselves out of the body, and you're able to actually live a normal life. So what causes cervical cancer is a persistent infection with the high strains, or rather the high risk types of the HPV virus. I hope that's clear. So now that you've highlighted some of the prevention methods, which is the HPV vaccination, and also through screening using the three methods that I talked about, HPV, VIA, and pap smear, I think it's good we highlight some of the treatment methods that you can actually get for precancerous lesion, which means there's a precancer stage. Pre means like before it becomes a full-born disease. So some of the treatment methods, of course, that can be provided for precancer, and this is, of course, after you've done the screening and depending on the type of findings that they find after they have checked your service. So basically, some of the treatment methods that I can highlight here is cryotherapy, which uses a freezing method. Basically, they just freeze the cells in your cervix and then they fall off. Then the other one is the thermoablation that uses heat. So heat basically is, of course, in a trauma of the cervix, and then after that the cells die off and then they fall off. The other one, which is the last one, is surgery, and it's called LEAP. So basically what they do is that they cut those cells that are bad in your cervix, and this is something that can be done under local anesthesia, which is, of course, through a gynecologist or a trained clinical officer. So basically what they do is that they remove the cells, and of course, after some time, you're supposed to come back with after a year to be able to get a follow-up checkup to see how your cervix is doing. So those are some of the available treatment methods. I'm sure. And now with advanced disease, there are so many other things we'll have to go through depending on the stage of the cancer. So you may have to go through maybe chemotherapy, radiotherapy, depending on what your oncologist now tells you that you need. So, but I think it's good that we mention about the prevention part, whereby you can do the screening, the vaccination, and also the treatment of the precancer. So I guess after this video now you feel a bit more educated on your cervical health. In case you have any questions, concerns, or you actually need to be directed to maybe a gynecologist or any doctor or a nurse to get for your screening done, you can also let me know. And of course, put your details on the chat box or DM me on my Instagram, which is Binti Afya Initiative Africa. So I guess that's it. And again, I want to wish you a happy Mother's Day, wherever it is that you're celebrating from. Make sure that you send a message or a hug, or yeah, have lunch with your mom for those who are able to, or maybe do a video call, whichever really suits you. So just celebrating this Mother's Day by reminding you guys that you need to take care of your health. Self-care is really the best of care that you can do for yourself. So thank you so much, and hope to see you soon in the next video. Mwah! Love you.